told alcohol in mouthwash is bad, right? What if I told you that is not the full story? Today, I'm going to walk you through the science about alcohol in mouthwash. We've all grown up hearing that alcohol dries your mouth or could be harmful. Even some dental advice says avoid it. It goes beyond a discussion about alcohol or no alcohol. I believe it's how we use mouthwashes, and in this case, Listerine, to help us care for our teeth. Listerine is made with essential oils that do all kinds of good things, including helping your gums grow and developing healthy biofilm to protect your teeth from abrasion, from infection, and from sensitivity. There was a new article fairly recently that I went through in great detail because I was so surprised by this headline that alcohol puts healing on hold. And it derails basically the recovery in the mouth. So it would indicate, and I think it was even mentioned, that skipping alcohol supports faster oral healing. Now, the problem with this is that that is absolutely incorrect information. It's partially true. So here's what you really need to know. This kind of headline subtly pushes an idea, in this case that alcohol, and it actually mentioned Listerine, is somehow a problem for the oral microbiome and healing, which is in direct opposition to what I've seen for 50 years as clinical reality, and also to the studies that in fact have looked into this and were quoted at the end of this article. I read them, but I think many people only read the headlines. So why do these studies point a finger at Listerine? And we have to go back actually to a study with chlorhexidine. Now, this may sound confusing to some people, but Listerine's the popular mouth rinse that's so demeaned and is actually can be so useful, particularly for healing gums. People confuse it with chlorhexidine ever since a study was done with chlorhexidine, not Listerine, chlorhexidine. There's a world of difference between a hospital-grade surface antiseptic like chlorhexidine and the essential oil rinse Listerine, which is so gentle and promotes healing. I think we're going to see more and more people wake up soon and understand that Listerine has essential oils. It has eucalyptus, menthol, thymol, and wintergreen, all essential oils that in actual fact play different parts in promoting healing and the suppression, gentle suppression of certain bacteria so that the good bacteria in your mouth can take over. So the main thing to know is that not all mouthwashes are the same. They're different and they have different properties. Many excellent studies have shown the mouthwashes I recommend, specifically Listerine, are useful and safe for oral health. Now, I recommend Cool Mint or the original, not all the other flavors, not all the other kinds. And for 50 years, I have used and recommended this mouthwash and have absolute confidence in it, despite the most recent hysteria about Listerine. Chlorhexidine, I have never recommended in 50 years of being a dentist, is often recommended after surgery. You may want to reconsider that or talk to your dentist about that. But don't misconstrue. Don't put Listerine in that same bucket. And because Listerine has alcohol in it, you may think, especially if you've read this most recent article that puts alcohol in such a negative light, that the alcohol in Listerine may be a problem. But we have studies to show it is not. So why would this article be written this way with such bias? I think that some dentists and hygienists believe people need to be helped. I'm not sure that they think you're stupid, but maybe it's almost irresponsible because the truth could be misconstrued. Personally, I think my responsibility is not to be your mother and tell you what I think or what I think you should know, but to tell you what the truth is so you can make better decisions. Do I condone all alcohol use? No. I think alcohol has to be used responsibly, but I think to cast it under a completely negative umbrella is to misconstrue the studies that we have. What are the studies about alcohol's effect on healing? The negative effects are only seen with acute and chronic misuse and overconsumption of alcohol. The truth is that moderate or light consumption of alcohol may in fact have some beneficial effects on improving epithelial nitric oxide production. It can lower blood pressure, improve circulation, and may actually help healing. Now, that doesn't mean you go out and drink after surgery, but the headline readers, the people who only read the quick headlines, would never know that there are studies to show a small amount of alcohol is of no consequence. Chronic alcohol consumption certainly can perturb cellular function. It can perturb organ systems. It's not chronic or acute alcohol consumption is not good for your health. Agree 100%. But to mix this into a study and point at mouthwash as somehow being involved is completely wrong. So there are no studies to show that the alcohol in Listerine has any negative effects, especially if you use it the way I recommend and part of my complete mouth care system. It does not damage the healthy oral microbiome. I have tested that on myself, my family, my kids, my patients. I have optimal nitric oxide producing bacteria in my mouth. And if you don't know anything about nitric oxide, that is another major concern that has been misconstrued and put to demean the effects of Listerine in the mouth. And no, I do not work for Listerine. I have never received any commission. I just know it is a very beneficial mouth rinse and a very important part of my complete mouth care system. So let's close by looking at a study done in Spain, in Valencia, Spain, in 2012. They looked at changes in the skin of the mouth, the oral mucosa. They took 2 mouth rinses, one with alcohol, which had the exact same amount of alcohol as in Listerine, and one without. And they did direct cytological, which is the cell. They looked at the cell and the skin, any changes after 6 months of using these different kinds of mouthwash. And they did a changeover. And what they saw in this very good study after 6 months was that people using this mouth rinse with 26.9% alcohol had absolutely no difference. There was no clinical change or alteration at the end of the study. Both groups exactly the same. And there was a second study done, and the headline of this study was Evidence for the Safety of the Daily Use of Alcohol-Based Mouth Rinses. And if you don't read the study, you might immediately think, oh gosh, can't be safe. But if you read this study that was done in Brazil, you will see that although they looked closely at the use of this alcohol-based mouthwash over a good period of time, they saw no undesirable effects whatsoever. They also, in this study, show there is clear evidence that these alcohol-based mouthwashes can be beneficial for daily oral health routines. They concluded there is no reason to avoid the use of an alcohol-containing mouthwash, as long as they're used following proper guidelines, and I would say my guidelines, and the manufacturer's instructions. So this alleged correlation between oral cancer or alcohol-based mouth rinses is weak, it's inconsistent, and it's actually contradictory. There is no evidence in the literature anywhere that there is a risk to patients who use these alcohol-containing mouthwashes in a responsible way. So this should make everybody who's using my complete mouth care system happy and encourage those of you who haven't tried it yet. Because I have 50 years. That's why when I read these studies, I really read them, because I don't believe what I am reading in the headlines sometimes. And what I read in the headlines is so often not the truth. So I'm not trying to catch people out. I just want to encourage people to use these amazing products that, when put together, can really change your mouth health forever. And be confident and not be worried and not be scared by fearmongers who are just promoting headlines without reading the full study. So next time you read an article with a scary headline, remember, an article isn't science. An article is somebody's opinion, possibly with bias, and definitely, in most cases today, written to get attention, more than follow the science. This is so frustrating if you're looking for the truth. I have many videos on my channel to help you learn how to use Listerine and how to use all the products that I recommend for your mouth health. And if you want to dive even deeper, maybe go to learn.drellie.com and check out my new gum and tooth rebuild program. Thank you for watching, and let's keep you and your teeth healthy and happy.